Fertility preservation is with the intent of trying to preserve someone's fertility so that they'll be able to use either their eggs or sperm at a later point in time. Currently, we're focusing on women trying to preserve their fertility, and that can be for any number of reasons. It can be because a woman has cancer and she's trying to preserve her fertility before she goes through either radiation or chemotherapy that may damage their eggs. For women who have significant systemic diseases like lupus or rheumatoid arthritis that may have to go on chemotherapy to also treat that disease. Or for women who are just not met the right person yet and want to preserve their fertility so that when they do meet the right person, they're still able to use their own eggs, their own sperm, to be able to preserve that in the future. And again, especially for women, it's most important because with increasing age, they have decreasing chances of pregnancy. And by preserving their fertility at a younger age, they can use those eggs at any point in time during their lifetime. Egg vitrification is a process where women undergo IVF stimulation to retrieve their eggs and then subsequently freeze them. We did a study in 2006 and 2007 where we had women undergoing the vitrification procedure just to test it and see what those success rates were. We saw that the survival of the eggs was about 90%, the fertilization rate after they had been frozen was about 80%, and the pregnancy rates were pretty comparable to what they were when the women were, or at the age of the woman when she had frozen her eggs. So for example, a 34-year-old woman would still have a pregnancy rate close to about 70%. For women who are preserving their eggs for social reasons, so not necessarily for any disease, but they just want to preserve their fertility for later on because they're either not in the right relationship or just want to defer childbearing for a while, the earlier that they can freeze the eggs, the better off that they'll be. With increasing age, chances of pregnancy are certainly going to decrease, so it's better to freeze them as early as you possibly can.